Welcome to the Healthy OC segment on Real Orange. I'm Heidi Cortese. February is National Heart Month. The heartbreaking news is heart disease remains the #1 cause of death in the United States. Here today to tell you how to avoid serious heartache is Dr. Aidan Raney, Hoag Hospital Director of Cardiac Surgery. Welcome, Dr. Raney.
Thank you very much, Heidi. It's good to be back.
Thank you. Why is Heart Month so important to everyone?
Well, as you mentioned, it's the #1 killer across the nation. So that's the primary reason that Heart Month is dedicated to raise the awareness of people for this disease process that kills most Americans, or is the #1 killer, and also to try to modify their lifestyle and have them be much more heart healthy.
What are some of the things people can do to improve their lifestyle and improve their heart?
Well, I think they have to make a commitment to do a little bit better job than most of us do in terms of our weight. I think exercise is a big area of neglect. Certainly smoking cessation, those kinds of things, watching blood pressure. Lipids are very important. Some people, many people, even young people would have or could have high lipids if they have family history of heart disease and not know it. So those are all the kinds of things that will help protect them against the development or progression of coronary artery disease.
Could you please explain the difference between coronary artery disease and, say, a heart valve problem that people might experience?
Well, in heart disease, we have two major categories that we deal with. One is coronary artery disease, and the other is valvular heart disease. The valvular heart disease side of things is generally not aided by living a healthy lifestyle. So people with valvular heart disease are those at risk who have maybe a family history of valvular heart disease, who have potential risks of infection, who've been told they had a congenital heart problem, or people who have been told they have a heart murmur or a prolapse of a valve. But many people don't know they have a valvular problem, and it goes undetected until a physician, for example, he listens to the heart and hears a heart murmur.
Would that be the first symptom, to hear the murmur, or would there be some sort of physical symptom that would occur?
Well, most people who we see with valvular heart disease don't have the typical chest pain. What they first start complaining of or noticing is increased fatigability, decreased exercise tolerance, shortness of breath. Those are the main symptoms initially, and of course they can become more progressive to the point where somebody can't even lie flat in bed at nighttime because of the problems with the heart valves.
How does one go about getting diagnosis for something like this?
Well, the easiest and the gold standard really is the cardiac echo, and that is a test in which a probe is placed on the chest. And it's a non-invasive study, so there's no pain or needles involved. And ultrasound waves are bounced off the heart, and the valves are then analyzed. We have 4 heart valves, and they can become narrowed or obstructed, or they can leak. And so there's a variety of problems that can happen with each of the valves.
Now, if one does have a heart valve problem, what are some of the remedies for this?
Well, the main concept is that heart valve disease doesn't respond to medications. It's a mechanical problem. As I said, the valve is obstructed or leaking. So the real treatment is a mechanical treatment, which usually involves replacing the heart valve or repairing the valves. And that can be done with various techniques and newer techniques coming out.
Now, I understand that Hoag has robots that perform surgery, robotic surgery. What's the big difference between robotic surgery and, say, regular surgery?
Well, in the robotic surgery, actually the robot is an assistant. It's really the surgeon that still does the surgery.
Oh, okay.
But this allows for a very small incision, this big, with 2 arms that go through the ribs, and that allows us to do repairs, for example, on the valves that we would otherwise have to perform a larger incision to reach.
Very quickly, is there less downtime with robotic surgery, for instance?
Yes, there's a real advantage in terms of that. Patients are in the hospital for 3 or 4 days, and we had a track coach just a number of months ago who had surgery, and 2 weeks later he was back coaching track and teaching high school.
Thank you very much. And we certainly appreciate all the hearty information. I'm Heidi Cortese for the Healthy OC. Be well.